Dr. Ortiz, what can a person expect when they're going for their annual physical?
Well, an annual physical is very important for all ages, and what you can expect is your doctor to question you initially about your history, medical history, what your family history is, what your social history is, what your work history is, what kind of stresses you may have in your life, how you react emotionally, how you react mentally to stress and to things that are going on that may be normal or particularly abnormal in your case. The history is key. Any history of family history of hypertension or diabetes is key to ask as well. So you're going to be asked a series of questions about your history, and then of course a thorough physical exam where the doctor examines you from head to toe, checking your eyes and your mucous membranes and your pulses, and your heart and your lungs, all the way down to your circulation in your legs and so forth, to get a good idea of physically how you're doing. Is there heart murmur? Is there any noise in your lungs? Is there belly pain or tenderness? So on and so forth. Based on your complaints, the physical exam can be focused on a particular organ system or part of the body, and then the doctor's going to ask you to do a series of lab work. Generally, this lab work will include a complete chemistry, which looks at your kidney and liver function, which looks at your chemistry, CBC, which shows you your white counts and your red counts and your hemoglobin, a urinalysis to look for debris in the urine or protein spilling in the urine, which may indicate some kidney involvement or damage, and then maybe a thyroid test and a vitamin D test, which today seems to be a good place to screen, particularly on an initial annual physical. We spend a lot of time doing annual physicals, particularly on the elderly, because of their more complex problems, their more chronic diseases that may be accumulating. And so they do require a little bit more time in an analysis because you're reviewing a list of medications, the response of those of the body to those medications. Is the patient tolerating those medications enough to be able to be totally compliant? And compliance in general, just to be sure that you are taking the medication the way it's been prescribed and the way we know that it works, so that you get the full benefit. Then you compare that to the outcomes that you get with your lab work, with your symptoms, with your overall well-being. I always spend time during the physical talking about diet, exercise, sleep, which are key elements to maintaining wellness, because my idea is to prevent disease, to control the chronic disorders, and to create a sense of wellness and quality of life for that patient going forward, based on a plan of care that they agree upon, that is reasonable for them within their insurance, within their ability to economically cover the medications and the therapies that you're recommending, and then implement that using a care coordination, phone call follow-ups, telemedicine, and other methodologies to be sure that that patient stays on track, that we can continue to monitor their data, to be sure that they're staying under control, and for a good patient-centered medical home or a patient-centered practice, what's important is the sickest patients get the attention, and everybody else does what they're supposed to do to maintain wellness. And that's my approach to the annual physical.
Perfect. Thank you, Dr. Ortiz.